Thank you. So, I have to tell you about a social problem that I have. The problem is when I'm at a wedding, imagine being in a social situation, and you're like at a wedding or something, and you're sitting at a table, and you don't know the people that you're sitting around with, so you have to make small talk. What's the first thing that comes up within 5 minutes of meeting someone new in these kind of social conversations? What do you do? I always dread when people ask me what I do, and I try and kind of say and be as general as possible, and I say, I'm a scientist or I'm a researcher. And invariably, the next question is, oh, what do you study? And I take a deep breath, and they're smiling at me, and I say, infant pain and infant mental health. And their smile drops, and they have this weird look on their face. And I know that they're either thinking now, is she a mad scientist who tortures babies for the sake of science? Or is she some sort of quack clinician who has a little baby on a therapist couch and is showing these Rorschach ink blots or something? So I do neither of those. I am a researcher. I've dedicated my life to understanding infants in pain and their caregivers. And the talk I'm going to give you today is for you to understand why infants in pain are allowed to think sometimes that adults suck. Reason number one. When I left York University, I did my undergrad here, which I think was the best psychology department in the world to have done it. I went to the University of British Columbia to become a graduate study to study pediatric pain. One of the first articles I read was written by two clinician researchers who had published a study in the 60s talking about because not enough babies died, they did not need to manage infant pain after surgery. Side note is that they did note that when you cut open a baby to operate on their heart, they wriggle a lot. So you have to use a paralytic drug or a drug that keeps them still, but it's too dangerous to manage their pain in any way. That happened. Infants have been screwed over by the medical system. So you think, okay, this is happening in the clinical world, but in science, like researchers, you don't need a PhD to understand that babies experience pain. And with a graduate student here at York University, I was able to kind of answer the question, or begin to answer the question, what happened? Why did people ignore infant pain for so long? But I got embarrassed because I read a study by a psychologist who followed 76 infants over the first years of life and gave them over 2,000 pinpricks to test when infant pain development worked. Scientists were poking babies unnecessarily to understand when infants started to feel pain. So reason number two, infants have been screwed over by scientists. But the studies that I'm talking to you about, they're from the 40s and the 50s and the 60s and the 70s and the 80s. Today, in 2015, we don't need to worry about that. This is a headline from January 2015 in response to the measles epidemic by arguably one of the most influential newspaper outlets in the world. Let me talk you through it. There's a caregiver, a clinician, holding the baby's thigh and injecting the immunization in the baby's thigh. And then there's a caregiver at the top pinning the baby down. Across the world, this has often been shown to be common practice today. Do you think the New York Times thought that this was such an inflammatory type of photo? Trust me, they do now. Reason number four. The problem is with infant pain and infant mental health is that if you don't manage it, it doesn't just affect the baby in the moment. It affects that baby and can affect that baby and the adult this baby becomes. If you don't manage a baby's pain and distress, what can happen is it changes how the baby's brain will work and process pain and distress. It will change the way the baby's body will process and understand. It will change how that baby feels and thinks about pain. So reason number four is that by not managing a baby's pain, both physical and mental health implications result. So we live in a day and age where I think the vast majority of clinicians and scientists and people will say that infants do experience pain, that infants' mental health does matter. But we're left with the problem, and this is what I've been dedicating my life to, is understanding how to do this best. So reason number 5 that infants in pain can think that adults sometimes suck is because not enough adults know how to manage infant pain in medical settings. I've been very fortunate to have been able to grow my program of research at York University in the Faculty of Health. And after we finished a study, it's one of the largest in the world, where we followed 760 infants and their caregivers over the first year of life. We looked at what caregivers did, we looked at what caregivers didn't do, and we looked at infant reactions. And so I wanted to put something together that was quick and easy, that any caregiver, whether you're a mom, a dad, an uncle, a nanny, anybody could do when an infant was experiencing pain in these medical settings. I call them the ABCDs of pain management. There are many more evidence-based approaches to manage pain, both with medication and without medication. And I encourage you to Google that. If you know someone who's getting a baby immunized or having a baby undergo a medical procedure, I encourage that. In fact, the Hospital for Sick Children, one of the places that I do my research, has a fantastic website about kids' health, and I encourage you to go there. One thing to understand about the ABCDs of pain management for infants is to understand that your stress level as a caregiver makes a difference. The more stressed you are, the more stressed they are. Because I am willing to bet the vast majority of you did not have your pain managed when you were an infant. You may not have those memories, but you remember. How much do you love going to the doctor? When you think about over the first 2 years of life, almost every interaction with this health professional was the most painful thing you've experienced in your life. For healthy infants, that's the truth. What do you think that does? So you're stressed. You need to assess your own anxiety and be calm. And what's one of the best ways to be calm? Breathe. Take a deep breath. And we call them belly breaths, or if you want to be fancy, diaphragmatic breathing. But all that means is that you just need to take a breath and make sure your belly moves and not your chest. It will lower cortisol levels. It helps you focus. And you know what it does very importantly is it calms your heart rate down. And where should that baby be? On your chest, close, listening to your rhythmic, smooth heartbeat. Not the stressed heartbeat, the smooth heartbeat. Because then you'll be able to do number C. Bring the infant in to a calm, close cuddle. We are pre-wired as human beings to need a caregiver to keep us close when we are in distress, when we're in pain, when we're hungry, when we're lonely. We signal to caregivers. That is what we are born knowing how to do. Immunization should not be any different. Hold your baby close into a calm cuddle. And then the last one is a little tricky, and we're working on it. But I believe today that if you, after the baby has gone through its highest distress, that kind of scream that everybody knows, that they've been poked and it hurts, and they've started to catch their breath a bit, start trying to distract the baby. Hold them close and try and use anything, car keys, bring a toy, show them a picture in the doctor's office or the nurse's clinic office. Show them anything to distract their pain, to help them get over this distressing context. So I'm hoping that even if you don't have a baby, and many of you likely don't yet, but you probably know people who are, tell them that infant pain matters. Tell them that infant mental health matters. Because what I'm hoping is that for my next TEDx talk, it's going to be why infants in pain think adults are pretty awesome. Thank you.